Ladies and gentlemen, good afternoon. It's my hope the day is going on well. Mine is fantastic. Today we will continue with our topic of yesterday, whereby we were discussing about hemorrhoids. But before we continue, let me start by appreciating you people for the support and the love you are showing me. We are currently at 8.5 thousand subscribers, road to 10,000 subscribers, and I'm sure with your support we are going to achieve it. And I'm happy to have you guys as my family. So let's continue subscribing, liking, sharing, and commenting on our videos so that they may reach as many people as possible. Let's get back to our point of discussion, whereby we were discussing about hemorrhoids, or what we call piles. And today we'll be talking about the risky factors, all factors that can predispose one to getting hemorrhoids. So, as you age, as age goes by, or as you grow old, your risk of hemorrhoids increase. Your risk of hemorrhoids increase as age increases, or as you grow old, simply because tissues that support veins in your rectum and anus can weaken and stretch. Because tissues that support veins in your rectum and anus weaken and stretch. This can also happen when you are pregnant, as baby's weight puts pressure on your anal region. So let's discuss about the complications associated with hemorrhoids, or what will happen if hemorrhoids are not treated or managed at the right time. Number one, though these complications are rare, but if they happen, they include, number one, anemia. This simply means low blood count. It's rare, but chronic blood loss from hemorrhoids may cause anemia in which you don't have enough healthy red blood cells to carry oxygen to your cells. Number two, we have strangulated hemorrhoid. Strangulated hemorrhoid. If blood supply to the internal hemorrhoid is compromised or is cut off, the hemorrhoid may be strangulated, causing extreme pain. So this simply occurs as a result of blood supply to the hemorrhoid. That is when it gets strangulated, and it might cause pain and discomfort. Number three, we have what we call blood clot. Occasionally, if a clot can form, in a hemorrhoid, for example, in the case of thrombosed hemorrhoid, although not dangerous, it can be extremely painful and may need to be lanced and drained. So if blood accumulates in an hemorrhoid, for example, an internal hemorrhoids, like in the case of thrombosed hemorrhoids, it can be so painful and needs to be lanced or drained to relieve the pain. This means if you drain the blood away that has accumulated, or the clot, the pain subsides. Let's talk about prevention of hemorrhoids. Prevention of hemorrhoids. As we talked yesterday, hemorrhoids come as a result of pressure or straining during defecation or passing out bowels. So, the best way to prevent hemorrhoids, and this is very important, the best way is to keep your stool soft. Keep your stool soft so that they may pass out easily to avoid straining. So, to prevent hemorrhoids and reduce symptoms. So, the best way is to make sure that your stool is soft so that it can pass out easily during bowel movement to prevent hemorrhoids and reduce symptoms. Then you should follow the following tips. Let me repeat this. The best way is to keep your stool soft so that it may pass out easily. To prevent hemorrhoids and prevent complications and reduce symptoms, follow the tips below. Number 1, eat high fiber diet. Eat high fiber diet. This helps in improving your digestion or your digestive system. So, eat more fruits, vegetables, and whole grains. This softens stool and increases its bulk and helps prevent straining during defecation that can cause hemorrhoids. Number 2, drink plenty of fluids. Drink plenty of fluids and water. It helps to keep the stool soft, and if the stool is soft, passing it out will be easier and you won't create any straining during defecation that can lead to an hemorrhoid. Number 3, consider fiber supplements. Consider fiber supplements. As I have said above, fiber helps in digestion or improves digestion. So if you get or you eat fiber supplements, for example psyllium, it improves the symptoms and bleeding from the hemorrhoids. Number 4, don't strain. Don't strain. Here, straining and holding breath during defecation or when passing out stool creates greater pressure in veins in the lower abdomen, and this may lead to a hemorrhoid. Number 5, go as soon as you feel an urge to defecate. Don't hold your stool when you feel the urge to defecate. So when you feel the urge, go immediately to relieve the urge, because if you delay, the urge goes away. And if the urge goes away, water from the stool is absorbed back to the body. And this leaves the stool so hard, it will be hard to pass it out. And this pressure and straining to pass the hard stool out may cause hemorrhoids or may increase the chances of getting an hemorrhoid. Number 6, exercise. Exercise. Stay active to prevent constipation and prevent pressure on veins, which can occur with long periods of standing or sitting. The final point, or number 7, avoid long periods of sitting, particularly on toilet, as this increases the pressure in the rectal veins and anus, and this may cause a hemorrhoid. This marks the end of our first video today, and in our next discussion we'll be talking about hemorrhoids in pregnancy, or how can you deal with hemorrhoids when you are pregnant. Thank you for the support. Keep the support on. Let's continue subscribing, liking, and sharing our videos. Let's meet in the next video.